This segment of DelmarvaLife is brought to you by TidalHealth.
Lung cancer is by far the leading cause of cancer deaths for both men and women. How deadly is lung cancer? Well, each year more people die of lung cancer than colon, breast, and prostate cancers combined.
Now, although cigarette smoking is the top risk factor for lung cancer, non-smokers are not immune. November is Lung Cancer Awareness Month, and with us this afternoon is Dr. Kurt Wehberg, cardiothoracic surgeon at TidalHealth, who helps patients detect and battle this disease. Thank you so much for being with us this afternoon.
Thank you for having me.
So let me ask you a very basic question. I'll just kind of start from the beginning here. You've been helping patients on Delmarva here for quite some time now. Why did you originally want to start to help treat patients with heart and lung?
Interesting question. When I was a child, we grew up in a spiritual family, and my mom always told me, you have to pick a job that God is in your life somehow. So I also remembered at the same time she said, God lives inside your heart. So I chose a specialty where I thought God lived and do.
Really?
So I picked, none of my family members or doctors or in the healthcare. I chose to be a heart surgeon because I thought God lived there and still do. And so I chose a specialty where I could meet God every day. Now, as my career moved forward, and not only did I realize that there was a lot more to doing heart surgery than just taking care of people's hearts. Right. It's also taking care of people's lungs as well, because the heart's connected to the lung. Yeah. So my career path has moved forward towards taking care of people with lung problems too. And then that evolved into the whole robotics thing as well with technology.
Yeah. I'm back at that. That is an amazing story. That is amazing. We're talking specifically about the lung cancer, and I've heard that screening guidelines have changed. So what should or who should get screened?
Great question. That's evolved over the past 20 years. When I first started in medicine 30 years ago, most people presented with lung cancer at a late stage. And after doing many studies and figuring out ways to detect cancer early, we decided to develop a screening program, and really that correlated with the advent of the CAT scanner. So over the past 10 years, those guidelines or indications for who gets a CAT scan have changed quite a bit. And because every time we get a CAT scan early on someone and detect the cancer early, we save their life with it. We can get it out and cure them with the lung cancer. Nowadays, if you're 50 years or older, if you have smoked a pack of cigarettes a day, which means about 20 cigarettes a day for many years, and that's very subjective. Now, we have guidelines for that, but if a person who is 50 years old and has smoked tobacco over time, or has a family history of cancer, people who've never smoked before, we get annual CAT scans. There's low-dose CAT scans, no dye involved, quick, easy 5-minute CAT scan on an annual basis, and we are able to detect cancers very early.
Yeah, not good and gone. You mentioned robotics. Does that play a role anywhere in trying to?
So 3 areas of technology we have moved forward with lung cancer awareness. First is the screening, right, so we can detect cancers early. Now, when we do that with the CAT scanners, we've developed clinics. In the past year, we've developed 2 clinics in Sussex County in Delaware. That was an underserved area. Now we have two clinics where patients can come early. So getting the teams together, we've built 2, one in Nanticoke and one in Millsboro. Mm-hmm. The second technology is the treatment of lung cancer, which involves robotics, and that's where I come into play. I was one of the original pioneers in robotics and helped move forward the whole treatment. Nowadays, patients can come in, if they have a lung cancer, early stage lung cancer, we can perform a robotic surgery and they can be home the next morning. And the most important thing I think I've discussed before is that the advancement in technology with robotics allows us not to use narcotics. So our patients are narcotics free after their surgery, which is a huge benefit in our world today. Our patients can go home without having too much pain.
Right. That's incredible. Tell us about the pleural disease program.
So very good question. So part of the technology advancement in lung cancer treatment is also pleural disease management, meaning most of us heard of the word pleurisy, inflammation of the pleural lining. The pleural lining is basically a cellophane layer that wraps around the lung and wraps around the ribs. Many different disorders can happen with that. One of the things that can happen with lung cancer is that fluid can be pushing into the lung cavity. So in that case, we manage that fluid. Most patients who have lung cancer have fluid around their lungs. They're in the hospital once a week getting that tapped. We have a management system, a pleural disease team now, that we put in these long-term catheters, and I manage them as an outpatient. So they don't have to keep coming back and forth to the hospital. They can breathe easier now because they don't have the fluids in their lungs. We can manage that in our office, in our clinics.
Okay, we get to the point where we realize we need to make an appointment. What do we need to do to make an appointment?
Very easy. Get on our TidalHealth website. There's several clinics, one in Salisbury, one in Millsboro, one in Seaford now. And it's very easy. It's a matter of just making a phone call. There's insurance issues on who gets approved or not. I take care of that. I take care of there's always insurance problems. So what we do is I make phone calls, peer-to-peer phone calls to doctors and the insurance company and get it approved. And then we get the CAT scans every year for people.
That's good to know. Thank you so much for coming in, Dr. Wehberg.
Thank you for having me.
Very good information.